Yo! Why? Oh! Look at all of that. You started built up. What's up, everyone? My name is Dr. Mo, and I'm a dentist. Let's watch the removal of all of that tartar. Like in this video in particular, I'm gonna also address bad mouth breath in relation to this tartar. Let's go. Here, the operator is starting with the molars on the upper jaw. And as you can see, they're almost completely covered with all of that dental tartar. Let's address the really very common instrument that's used here, rather a device, that ultrasonic scaler with that tip, a sharp tip, and with the water cooling that helps in cleaning the region, as well as avoiding overheating on the tooth surface, because as that tip vibrates, it may cause some heat on the tooth itself. And heat is pretty horrible, by the way. Heat application on the tooth is really horrible. But with water cooling, normally also it's somewhat cold water, so it really avoids and try to minimize the risk of the tooth overheating. As you can see, also it helps in cleaning the tooth as the ultrasonic scaler operates. And this video's focus really is going to be more about dental tartar, teeth tartar, and halitosis. A lot of people may complain of bad mouth breath or case of halitosis, for example, is the term that we use. And what you need to know about halitosis is it can be caused by a whole host of reasons. One of the reasons is the accumulation of dental tartar and dental plaque, and this can be attributed to a number of sub causes which you may think about, as in certain bacteria that contribute to the bad odor. Also, you can think about as, oh, is that a hair or what is this? That looks like a hair that, or is that a hair? It's like some thing could have been stuck. It looks like a hair structure that is just bald. Oh my god. I got carried away with halitosis, and oh my god, it's crazy, really. Right, as I said, so what I'm trying to explain is how does the dental tartar relate to bad mouth breath or halitosis? I said the dental tartar itself. If you look at the structure of the dental tartar, it's basically a biofilm with bacteria, saliva, remaining food debris, and some other like factors. As I said, these bacteria, some of them could be contributing to a bad mouth odor, right? So, because one of the reasons also to halitosis, one of the causes is poor oral hygiene. And one of the things that may contribute to the formation and accumulation of dental tartar is poor oral hygiene, okay? So here the operator is moving to the front teeth in the canine region, and oh, look at that central incisor on the wait. Look at the central incisor. Looks like there's a cavity because the enamel is actually quite translucent. Looks like there's a huge cavity that needs to be addressed in that region. And fortunately, oh God, look at all of that dental tartar and calculus, and you can notice that in that upper wisdom tooth region, in the upper molar region, there's like walls of dental calculus that accumulate there. For some of these teeth appear to be mobile a bit, meaning moving a bit, or maybe it's just huge chunks of dental tartar that are moving. As you can see, the operator here is also trying to break down those dental tartar huge pieces into smaller pieces so that it's easier to be removed and so that it's easier to be suctioned because this can be blocking the suction tube. The suction tube is the one that the system is helping with to remove all of that gunk and tartar. Okay, so we're trying to focus on um, halitosis in relation to in tartar. I talked about bacteria could be contributing to this, the gingivitis and inflammation of the gums as well to a certain degree, and even gets worse. Oh, look at that! All the structure coming out up there, which is getting more surprises as the video goes. Oh my God, this is pretty insane. What is even this? Looks really insane, because when all these walls of dental plaque accumulate, um, it's like anything could be underneath those huge walls of dental calculus. So I'll talk also more toward the end of the video about ways you could try to prevent this, but I'll dive deeper into those prevention methods in different videos because this one's more about halitosis. Oh, wow. Oh, that is it. It couldn't even fit into the suction tube. That was a gigantic piece of. Wait, what was that? This so. Oh my God. And by the way, I just want to address there's it looks like a cheek retractor pushing the cheek away so that the what is cheek retractor? Yeah. So that the operator can work on Yeah, so that the operator can work on the molars region. So this is the palate. They're working on the palatal. I just wanted to look more closely. This looks like the tongue. They're pushing away the tongue, excuse me. But the instrument looks a bit similar to a cheek retract because there are certain instruments used to help push away the cheek. But look at the tongue movement, and because there's so much dental calculus, this is the palate. This is the palatal side, just to be clear, okay? Anyways, so and look at how the tongue's full of muscles trying to push away that retractor. There's also a tongue retractor, just to be clear. And the tongue's being pushed away. There's like suctions everywhere, and the operator's just having this fight with the walls of dental tartar and dental calculus. It's of course really sad to see, honestly, a case like this. Downtotter should never be left to reach this late stage of accumulation because this happens over a quite prolonged period of time. Normally, it's not really happening like in a week or two. This takes a very long time to accumulate and to reach to a stage like this. I just want to add that the tartar itself provides like a porous surface, so it's like a more inviting surface for the bacteria to grow and to harbor. Harboring odor-causing bacteria. Okay, so it's even surface. It's like really helpful for all of those bacteria to have their holiday on that porous tartar surface and to just make the situation worse. Trust me, the bacteria there, they're like having the time of their life, and they're probably really upset that that really amazing operator and dentist here is just like attacking them with that ultrasonic scaler. But look at how this ultrasonic scaler is really effective at like addressing even small pieces of the dental tartar and dental calculus that are deeper into the gums. Now, of course, we have certain instruments that can help us to go even further deep into the gums if it's necessary. I will address those on different videos. So if you're not subscribed, definitely subscribe to the channel, turn the notification bell on, and like. We really appreciate everyone's support. We've been growing significantly, especially on recent videos. Okay, so this area looks like it's clean already. Maybe you went over it. So this is what I'm talking about. As you can see, this is the cheek retractor and goes over the lip, but the operator is switching sides. Now they're going into the palatal. Why do we say palatal? Because it's toward the palate. Okay, that's where the term comes from. As you can see, all sorts of foot remaining particles. There's also stains that the operator is working on as he goes on the cleaning of the tooth. And this, oh, look at this. I did not expect this. So looks like part of the tooth here is fractured. Why? Because it can differentiate. It's like the enamel, and looks like this is the dentin, which is the layer underneath the enamel in the crown of the tooth. So the dentin acts as a cushion layer. I didn't expect this to turn into a dental anatomy lecture. I was thinking about halitosis more. It's a bit blurry now, but it will be clear as the operator proceeds to the premolar region. Very interesting so far. Also, I just wanted to add a note that the dental calculus not only accumulate on the uh, facial, buccal, like labial, and lingual and palatal surface, but also accumulates on the occlusal surfaces where the patient may chew or is even eating. So they can also accumulate in the grooves, etc. Unfortunately, looks like on some of these molars, there's also some recession, some gum recession, not economic recession, although we may see that soon. No, I'm just kidding. Actually, we may, I don't know. There's some gum recession, at least in the US, going in there. Okay, so it's like, oh, oh, okay. So look at just how, before we get to it, look at how there's the tongue on the here, either assistant or operator, I'm not sure, inserts that tongue retractor just to retract, push away the tongue. But look at all of those walls of dental calculus. It's really insane. Look at also all of that dental calculus that accumulating on the occlusal or the chewing surface that I said about. There's also certain black spots again. Um, these black spots better if we clean all the dental calculus in the dental tartar, and then we can address them on really teeth that is uh, somewhat clean from all of the dental tartar and callus. Look, this tooth appears to have also a cavity here and some stains around it. The operator shifts to another place as well, and this appears to be the lower front teeth, especially from the lingual view. I choose these videos for you guys and girls because it's really very close to a dentist view. Like this is a very high quality, really it's a dentist view. And the dental tartar has a tendency to accumulate in those regions, especially the lingual region, meaning toward the inside of the lower front teeth. Honestly, it's really pretty insane how much dental calculus and tartar, especially as we proceed to the premolars and the molar teeth in the back. It's very important oh, look at that huge piece of just popped off. It's very important to note or think about, well, why is also dental tartar common to occur in the lingual surfaces, like toward the inside. Multiple reasons. There's some salivary ducts that open here in the frontal region of the floor of the mouth. That's called the floor of the mouth. Okay, underneath the tongue. Uh, so saliva is good. Of course, it's really good. It helps with something called as it has the minerals to help with remineralization. Other than this, unfortunately, certain minerals can also contribute into the build-up of that dental tartar. You have to take this into consideration with the poor oral hygiene, the person not flossing, not following just pretty much basic oral hygiene instructions. And now we are getting into the molar and premolar region with the ultrasonic scaler, and we're popping off these huge pieces of dental tartar. And sometimes that dental tartar is too big to get into the suction tube, and the operator may need to use an instrument that's called as a tweezer. to grasp and move away, throw away that's the diffuser. So whatever the operator is pulling away from the diffusion, all of those also inflamed gums, and they're just pulling out like random stuff from underneath those walls of dental calculus and dental tartar at this point. It's really interesting what's going on, and that is a kind of not kind of this is somewhat of this like severe degree of dental calculus accumulation. Typically, you would never want to allow the dental tartar to reach such advanced stage uh, like this. And also note how the operator is trying to break that huge piece of dental tartar into smaller pieces so that it would be easier to be removed off. And this is too big. It looks like to be even removed into the suction piece of it fell off. It's like barely, the assistant here is grasping these barely with the suction device. So far, really good. Fortunately, look at the down focus and down tartar, how it is accumulating on the occlusal surfaces of these molars. As I said, the occlusal surface as in the surface that this person eats on, and for a bit to keep picking up stuff from the tooth itself. Again, as I said, the operator breaks that huge dental tartar into smaller pieces so that it would be easier for it to be removed. And some of these pieces, as I said, they're hard to, like, look at the suction struggling to take that huge piece, and it's really, really interesting. Look at how inflamed the gums actually are in relation to the smaller. Look at the amount of dental calculus and dental tartar on the um, so far so good. Operator is doing great job at this, and unfortunately, the gums are not only really inflamed, but looks like the blood vessels they're irritated, and there's of course a lot of bleeding. Bleeding is typical during a dental scaling procedure. There will be some bleeding, but this is a bit more exaggerated because of the sheer size of all of that huge tartar and dental calculus. I am fast forwarding a bit because I want to see things toward the end result. Okay, so this is an important part because the operator is trying to clean the dental stutter and dental calculus in the wait, we'll get to the occlusal surfaces of these molars. So far, so good. And now we have this huge piece in between the teeth and trying to take it off. Like, why wouldn't you turn on the just ultrasonic scale and break it into pieces? Just like one huge piece. Wow. Oh, that's a huge piece of dental tartar and dental calculus. Let's see toward the and just clean off the tooth right there. Look at all of that gum recession in the region. Pretty insane, to be fully honest with you. Let's fast forward a bit, just looking for a before and after. Okay. Okay, so looks like this is toward the end. This is the before, of course, huge piece of dental plaque and tartar, and I assume